Hi, everyone. I'm Dr. Valencia Porter, and I'm so thrilled that you are joining us today. I have some very important information to share with you about how conventional Western medicine, in which I am trained, often fails for chronic disease, and how functional medicine and Ayurveda can actually help reverse and prevent chronic illness and help you to reclaim your life. I'm going to share with you my personal healing journey, as well as the journey of one of my clients who had an amazing recovery. And then I will share with you this amazing program that I have created to help you reclaim your life, to take charge of your health, and to institute these foundational principles of health that so many of us are missing. But first, I want to share a little bit about my background. All right, so today we are talking about how functional medicine and Ayurveda can help you reverse and prevent illness and help you to reclaim your life. So first, a little bit about me. So I am a conventionally trained Western medical doctor. I also have a master's degree in public health, specializing in environmental health. I am double board certified in general preventive medicine as well as integrative medicine. I'm also a certified functional medicine practitioner, as well as a Vedic master and certified Ayurvedic consultant through the Chopra Center for Wellbeing, where I was the medical director. I have also been faculty at the University of Arizona Fellowship in Integrative Medicine with Dr. Andrew Weil, and I've completed many other trainings and certifications in multiple healing modalities to find the best ways to help my patients heal. So over the course of my career, I have helped thousands of people shift from illness to wellness. And many of them were able to get off of their medications. Many had reversal of their symptoms and lab findings and were able to get back to living. But I had my own health journey, and at one point life really smacked me in the face. So on the left here, you'll see what I was like 5 years ago at age 43. And the story actually goes back a long time, as it's actually likely that I contracted Lyme disease previously while I was living on the East Coast. So I had my own personal healing journey, coming back from chronic fatigue, chronic pain, cognitive issues, and I really had to dig deep to find these underlying causes. So I do recall back in my early 20s having tick bites, and I developed some really bizarre symptoms that resulted in me being worked up for multiple sclerosis. These included extreme fatigue, being unable to physically move, losing control of the movement of my legs, frequent horrible debilitating headaches, fainting, and episodic loss of vision in one eye. But after an extensive workup, conventional medicine found nothing wrong with me, and some of these symptoms actually eventually subsided, or I just learned to live with them. And it wasn't until my 30s that I discovered Ayurveda and holistic medicine after I completed medical school that I really started to feel good. And then fast forward to 2010, when I was expecting our second child, and I was really doing what I love professionally, working at the Chopra Center with Deepak Chopra. I was living a healthy lifestyle, and I felt great and was planning on staying at home with our baby for the full 12 weeks and then return on a part-time basis. I had just gone out on maternity leave when I received a call that my boss, my mentor, my partner in the medical practice, Dr. David Simon, had brain cancer, and it was glioblastoma multiforme. And while he and I both embraced all of the healing modalities possible, we both knew from our training as neurologists that the prognosis was not good. This devastating news came on the heels of my husband's good friend and colleague receiving the same diagnosis just 2 weeks prior and my mother having just passed away from ovarian cancer a couple of years prior, as well as also coming on the heels of the financial crisis. So about 6 weeks later and 1 month after the birth of our daughter, I ended up having an emergency appendectomy. And then about a week after that, I was asked if I could return early from my maternity leave, as there was a large event of more than 500 people coming up featuring Wayne Dyer. And unfortunately with David, the Chopra Center co-founder, now unable to teach the majority of the content as he always had, and having no other physicians on staff other than the doctor who had just been hired to cover for my maternity leave, I felt that it was my duty to step up and help out. And so I did. And thus began a very stressful time for me as we were trying to find our way without David at the helm and me picking up the pieces where I could. And here I was now working on new administrative tasks while pumping breast milk during the lunch hour, losing sleep, worrying about how things would go on without our leader, working more hours with less compensation, and missing out on the precious time that I had planned with our newborn and my older daughter. So by 2011, despite all of the wonderful practices that I had in place, meditation, yoga, healthy eating, I had lost my vibrancy and could not keep up. And I was traveling all over San Diego to see this healer and that to try to regain my health. But each of them was looking at their own narrow focus. And while each was a piece of the puzzle, no one was putting it all together. I spent thousands of dollars and countless hours to get better. And yet by the end of 2014, I was chronically fatigued. I was not sleeping through the night. I had chronic pain and arthritis in multiple joints. My digestion was a mess, and I had become gluten intolerant. My thyroid was out of whack. My adrenals were shot, and I worried that I had an autoimmune condition like my sister. I was just going through the motions of life like a zombie, but I was not really living it. And it was then that I discovered that I had chronic Lyme and Bartonella underlying all of these issues. And yet, even then, the doctors that I consulted with told me that I would just have to live like this, even the holistic ones. But something deep inside of me said, no, I'm not going to give up without trying. I'm not going to do that. I'm going to give this all that I've got and see if I can turn this around. And that's exactly what I did. So my recovery was not easy, and it was unfortunately complicated with me suffering a head injury, as you can see on this slide here, and ending up with post-concussive syndrome to boot. So life really smacked me in the face, but I have grit, and I was determined to fully heal from all of this. And now, more than 5 years later, I can honestly say that I feel better than I've felt in years. And even despite the recent stressors of this last year, I'm managing that too. I'm sleeping well, digesting well, my energy is great. I'm able to focus and be present for my family and my clients. And this is what I want to share with you. The tools that I use, that I've helped other people use to regain your life, to feel better than ever, to be able to resist illness. Now, I'm trained as a conventional Western MD, and I truly believe that those tools have a place. But when it comes to chronic disease, which I suffered from, and prevention of illness, which I'm board certified in, standard allopathic medicine just falls short. And this is part of the reason why. In Western medicine, we only see 2 stages of disease. You're ill or you're not ill. But as I learned in Ayurveda, which is a system of medicine from ancient India that dates back thousands of years, there are actually 6 stages of illness. And when we can impact our balance earlier on, we can prevent disease. And I have seen that working on these root causes, these root imbalances, we can even reverse it. So I just wanted to take you through a tour of what this Ayurvedic model shows. So in stage 1, as you can see on the left, that is the beginning. This is when imbalances of diet, lifestyle, exposure to stress, and environmental factors can build up. Now at this stage, symptoms are mild and intermittent and may include digestive symptoms such as constipation, abdominal distension or gassiness, feeling of hunger, cravings such as craving carbs, candy, and sweets. Or you might just feel worn out, heavy, lethargic. You might feel full easily and not even have much of an appetite. At this point, Western laboratory tests will not discover any abnormality. And in fact, the body's intelligence may try to correct the imbalance. For instance, if you've been eating ice cream every day for the last week, you might lose your taste for it or instead crave something spicy, and that would actually bring balance to your system. So at this point, when normal rhythms and processes of health are reestablished, these symptoms usually subside quickly and without discomfort or any further issue, as long as balance is maintained. Then stage 2, when we go into this provocation stage, that's when things continue. So the imbalance continues. You could continue with imbalances of diet, lifestyle, stress, and environmental factors. Then the symptoms start to worsen and function begins to be affected. For example, if you have been eating a lot of heavy foods, you might get an idea to take a break, fast, or eat more lightly, but then something might happen. Maybe you're invited to a brunch or dinner, and you might end up eating heavily again. So that's more dripping over into the bucket here. Then you might end up with further symptoms: congestion, indigestion, nausea, flank pain. So the symptoms start to get a little bit worse. Now this is still at a reversible stage if balance is restored, but once these symptoms continue, once the disease process moves beyond and spills over, then it becomes a bit more difficult to restore balance. And that's when we get into stage 3, or spread. This is when the imbalance goes into the body through the whole circulation, and we can get symptoms in other parts of the body. And then at this point, instead of leading towards rebalancing, sometimes we have cravings that can be distorted and actually contribute to the imbalance. Here we might have more recognizable symptoms such as numbness, heartburn, rashes, sinus congestion, as well as vague or low-grade non-specific symptoms such as aches and pains that kind of come and go, or just not feeling well. Complaints of fatigue, maybe mild depression. And people going to the doctor at this point will say, "I don't feel well." But lab tests are usually normal. So then the doctor may try to reassure you and tell you you're fine, or give you medications to mask your symptoms, or suggest perhaps an antidepressant. And then in stage 4, this is when that imbalance continues to move through, and it settles into an area that may have some weakness due to previous trauma or genetic predisposition, even accumulated emotional stress. So this is where you have these seeds of illness that begin to sprout if the tissue is not healthy enough to resist the imbalance. At this point, if progression is not interrupted, this is going to end up erupting as a full-blown disease, full-blown illness. And this is when we have the beginnings of organ and system dysfunction, although it still might not show up on a lab test or other standard diagnostic test. So here, stages 1 through 4, this is where Western medicine will say, "You're not ill, you're fine." It's only when you go into stage 5 and 6 that Western medicine will be able to pick something up. So at stage 5, manifestation, this is usually the point where people start to seek medical attention because the signs and symptoms are clearly evident and are visible for a diagnosis. At this point, unfortunately, the structure and function of organs and tissues is being affected and they can become damaged. For example, if you have had aches and pains for months or years, now you might finally receive a diagnosis of rheumatoid arthritis because there's been significant damage to the body to the point where the lab test is now positive. Or you might have damage to your joints that show up on an x-ray. And then at stage 6, this is where the disease really destroys tissues. You can have further complications, and these structural changes can happen, or you can have complications in other organs and related areas. This is where the disease has completely manifested. And for example, due to arthritis, now you might have frozen joints, deformity, and muscle wasting. So the affected tissues and surrounding tissues are all affected. At this point, the body's natural repair mechanisms are not able to reverse it without major assistance, and it has become a long-term or permanent disorder. And the Western approach is usually to address the symptoms, management of the symptoms without getting to that root cause. And if those root causes are not addressed, complications and secondary conditions can occur that make it even more difficult to manage or treat the situation. So it's much more effective, of course, to treat the illness in its seed stage over here, or even over here when we have an imbalance before it sprouts and grows. But I have seen clients, along with myself, show that addressing these root causes can put the course of illness in reverse. You can go from a stage 6 back down. It does take a lot of hard work and commitment. It takes a lot of digging to find all the roots, but I'm here to offer you some hope that you can take charge of your health and make a difference in your outcome, in your life. And so now I want to introduce you to Kristen, who is a wonderful person and a client of mine who had an amazing transformation and was able to reclaim her life. All right, thank you so much, Kristen, for joining us here today. I am so excited to share your story, share your journey, your health transformation, and I'm just so pleased to see how vibrant you are and how you've been able to really reclaim your life. So if you don't mind just sharing with us, you know, where were you? What had you done when you first came to see me? I know that you were already living a fairly healthy lifestyle, but you were really suffering quite a bit.
Hi, thank you so much. I struggled with an autoimmune disease for years. My symptoms were chronic fatigue and pain and debilitating nerve pain in my hands and my feet. Medications made me worse due to the strong side effects. I started doing blood treatments called plasmapheresis, which got me out of bed. I did them for about a year and a half. I wasn't doing great, but I was doing so much better than I was. I was able to do some activities during the day, but I was still limited. And then I went to the Chopra Center in San Diego, and I learned about Ayurveda and meditation and functional medicine, learned about foods to eat that were right for my body, learned new lifestyle tools, and that's where I met you, Dr. Porter, which seriously, just you're such a huge impact in my life. You were an investigator. You ran a bunch of tests and figured out what was going on in my body and discovered a gene mutation and toxins, especially a high level of styrene, which is a form of plastic. and I had implants, and we thought maybe it was related to implants, but my rheumatologist and neurologist said there was no way there was a connection. Back then, this was in 2013. I couldn't find anything online. So I did a strong detox for about a year, eliminating, all plastic, of course, and just detoxing my body. And the styrene continued to increase. So I did end up getting my implants removed and immediately felt relief in the nerve pain in my hands and my feet. It was amazing. I was shocked with how quick I felt a relief.
Amazing.
So yeah, so it was really exciting. So then my health continued to increase, and I was doing pretty well, but I wasn't doing well enough. Like, I knew I could still do better. So I really was looking at my life and realized I had some toxic relationships in my life. So I made a huge lifestyle change. And 3 months after making that lifestyle change, I had my blood work done, and it showed no trace of autoimmune disease. So the emotional toxins in my life, I needed to really break up with those in order to have a real breakthrough. So that was a hard time for me, but an exciting time with my health.
Yes, yes. I'm so glad that you were able to dive deep and really make that recovery. But I had a question for you. So when you were seeing your doctors before, what were they saying about diet and lifestyle and the impact that it could have on your health?
Oh, I asked all the time because I was healthy before I got sick. I was in great shape and was eating fairly well, mostly vegetarian, lots of smoothies during my illness. And I would ask the doctors all the time, and they just said nothing really. They never gave me answers. And as far as supplements, one doctor even said, if you want to waste your money, then go for it. But I'm not sure if that will help you. So that was frustrating because I literally really felt like there was more I could do. And I did. So I was researching myself all the time. I was listening to audiobooks, studying nutrition on my own, studying holistic modalities on my own to really find answers. And then when I found you, it just really, it gave me the real tools to really detox my body and turn my health around.
Yeah, wow. And how many medications had you tried before you started the plasmapheresis treatment? Do you know?
Dr. Porter, I think I tried them all because plasmapheresis was really hard to get approved. In fact, insurance denied it several times. I ended up being a case study and now was more approved for other patients going forward to get that treatment approved. But I think I tried every single drug because I'd try one, you'd have to give it some time, and then we'd try another one, and then another one. So literally I did IVIG, which is another plasma treatment. Plasmapheresis was the last medication, the last treatment.
The last step. And
Right.
can you kind of describe what happens with the plasmapheresis treatment?
Yes, I actually love it because it makes such sense now. So it's a blood treatment, and basically you're cleaning your blood. You're pulling your plasma out of one vein. I was really lucky because most people have to have a port, and I was really blessed. My veins were good, and I had an amazing nurse that really figured my veins out. She dug in there and figured it out. So anyways, they pull the blood out of one vein and spin it, pull your antibodies out, and then your clean blood goes back into another vein. So you're basically cleansing. It's a cleanse if you really look at it like that. So it makes such sense to me that how it worked. But I was told, Dr. Porter, that I would be doing them for the rest of my life. And I started doing them twice a week and then tapering down to every other week. And then I was at every 3 weeks. And they said I'd be doing them for the rest of my life every 3 weeks. And I was fine with that because I was seeing improvement. I was living. Mm-hmm. But then my last plasmapheresis treatment was a week before I went to the Chopra Center, the week before I met you. I never had a treatment again.
Wow. Wow. What a story. I mean, you've just had such an incredible transformation, and I really admire you for digging deep and doing all the hard work and, getting to those root causes and not stopping. You did not stop. You knew that there was another way.
Yeah, I had a strong will inside of me, even when I was super sick in bed and I really couldn't do anything. I'd listen to audiobooks and I just had a strong will, like, this is not the way my story is going to go. This is not. And then when I got to the next level of feeling better, I'm like, still, I know I can do better. I know I can feel better. So I had a strong will inside. And then I became so passionate about feeling good and health and nutrition and helping others that I went back to school, and I'm officially a integrative nutrition health coach. So I'm so excited that I get to take all the tools that I learned on my journey and my education and really help guide people to discover new lifestyle tips and foods to really turn their life around and feel their best too.
Yes, I am so excited for you to, number one, have reclaimed your health, but number two, now share your passion, share your knowledge with others so that they can also feel good and feel good again. Is there any other message that you think people should hear listening right now?
Just don't give up. And I would change doctors. First I started at USC, and then I went to another doctor that was supposed to be like the best. And then I ended up at Cedars-Sinai, which I did have a great rheumatologist, and they're all great doctors, but I wasn't seeing results. So I would switch doctors. You have to give every doctor a chance, and you have to give every medication somewhat of a chance, they say. But I just never gave up. I just had a strong will of knowing I could win it. And meditation helped so much. And then all the stuff that you learned about what was going on in my body to help heal my body. I mean, it's just the whole Ayurvedic medicine, functional medicine, all of it just really helped my healing. And my biggest message is don't give up. No matter where you're at, you can always feel better.
Great. Awesome. Thank you so much for sharing.
Okay, thanks. Thank you so much. I'm so excited.
Yay. All right. Thank you so much, Kristen, for sharing your journey. I really hope that people hear this. Kristen is just one example, an amazing example of how really addressing the root causes can help you shift, even when you're at a stage 6. I mean, she was at a full-blown stage 6 with diagnosed illness and getting, really severe treatments. And now look at her, she's just beautiful. So thank you so much for sharing.
Thank you.
You're welcome. So I wanted to share with you a little bit about, about the differences between functional medicine and conventional medicine, because some of you may not be familiar with what functional medicine is. And it is a fairly new term, but it's been around for a number of years. And when I first discovered it more than 10 years ago, and I learned about it, I said, wow, this is like Ayurveda, but with labs. So it's really combining that ancient wisdom of looking at the whole person, focusing on prevention, focusing on looking at the root causes, the imbalances, the nutrition, stress, all of those pieces. But now we have the opportunity to utilize some modern techniques to really fine-tune the approach. So, there's many different types of functional medicine practitioners, but I wanted to share with you just some of the differences between functional medicine and conventional medicine. So conventional Western medicine it's disease-centered. It's a very generalized approach, and you look at the disease. In fact, as I showed you before, they can't even treat you until you are at the stage 5 or 6. They don't know what to do with you really before then. Versus functional medicine, which is more patient-centered. They focus on you as the individual, and the approach is very personalized. It's tailored to you instead of, just some general protocol that they're following to manage a disease. In functional medicine, we see the body as an integrated system, all working together, versus in conventional medicine, where the body is this collection of independent parts. And I, really value my medical colleagues' knowledge and expertise, really being able to dive deep into illness. However, oftentimes their lens is so focused that they cannot see the whole person. And so you might go to multiple different doctors. You might have a cardiologist, a gastroenterologist, a neurologist, you know, you name it, all these specialists, but none of them are really talking to each other. And nobody is looking at these overall root causes of illness. So you end up with a collection of medications to treat all of these independent parts. And that's what's going on here in functional medicine. We use that root cause approach. We're focused on functioning. We're focused on getting the body to function better, work better, and then feel better. Whereas in conventional medicine, it's often symptom management, and you are working on that disease model. So we look for the one molecule that is disrupted or the one pathway that's disrupted, and you go for a drug that is aimed to target that one pathway instead of looking at the whole system. Functional medicine also is prevention focused. We want to keep you healthy, well, vital for as long as possible, whereas conventional medicine waits until you develop a disease. Even though I'm board certified in preventive medicine, so I can say that. And then functional medicine views health as optimal vitality of mind, body, and spirit. So when I look at people, I really take a deep dive into their whole life, not only what's going on now, but what's happened in the past, what happened with their family, what's going on with their relationships, their jobs. All of these impact our health, our vitality, our well-being, versus the conventional medicine approach that defines health as just the absence of diagnosed disease. So like we saw before in the 6 stages of illness, you cannot be feeling well in those stages 1, 2, 3, and 4. Conventional medicine doesn't really have much to give you. And in functional medicine, lifestyle and nutrition are tools. Like you heard Kristen mention, many Western conventional doctors don't even know about how to use that. I'll admit, our education system, our medical education system is deficient there. And many physicians, you know, maybe they got 20 hours of nutrition education, and that might be a high estimate. Conventional medicine, you know, we learn pharmaceuticals, so drugs, and procedures as tools. So those are the tools in your tool belt. An old adage that I learned in medical school was, if all that you have is a hammer, the only things that you see are nails. So if the hammer is your only approach, if drugs and procedures are your only approach, that's the only thing that you have. And that's why I became frustrated with conventional medicine and started to look elsewhere. I saw my patients getting better by shifting their lifestyle, by addressing their nutrition, and by looking at these underlying factors. And whereas my Western colleagues were poo-pooing that, I said, hey, you're getting better. Let me go follow that. Let me figure out what it is that's going to help other people get better too. And then I also wanted to talk about genes as well. And Kristen mentioned that I found a gene polymorphism in her that showed that she was not able to detoxify well. And that was part of the reason why I was really looking for that underlying cause in a toxicity, because I could see that those toxins were going to build up in her system. And whereas, you know, the old school approach is that, you know, you have your gene and that's it. There's nothing you can do. Now we know, in the last 10 years of, you know, research on genetics and genomics, that gene expression can be modified. It can be modified for good, and it can be modified for bad. So we want to target it so that you are modifying your genes in a healthy direction. And what modifies those genes? It's lifestyle, it's nutrition, it's environmental exposure. So all the things that we look at as root causes of illness, those are the things that turn your genes on and off and can influence if a disease is going to manifest for you. So those are just some of the differences between functional medicine and conventional medicine. So now you know, and I hope that you're excited about it as I am. I was just thrilled to add this as a tool in my tool belt. So I wanted to introduce to you what I'm presenting, what we're offering to help you shift your health, also to help you reclaim your health, to reverse and prevent illness. And this is the Resilient Health Reset Masterclass. And I'm going to walk you through what we're going to learn in this masterclass. And the pre-course, which is so exciting, it's so fun, is identifying your mind-body constitutional type. And this is based on Ayurvedic principles. So looking at, you may have heard the term dosha, your mind-body constitutional type. What is your makeup and what does that predispose you to? And by understanding this, you can really tailor things to your own individual needs. Because what I've learned is that there's no one size fits all. There's no one diet that's right for everybody. There's no one exercise that's right for everybody. You know, there are some basic principles that are true for most people, but really you have to become aware of your own needs and be able to tailor those to yourself. So we're going to start out with that amazing information so that you can use that throughout the rest of the course and hopefully throughout the rest of your life. I know for me, it made a huge difference. Then we start with the reset, and I made this fun mnemonic here: routine, eat, stress management and sleep, exercise and environment, and then taking out the trash and the toxins. So that's our reset. So by routine, what do I mean? You know, we have our daily routines and our rhythms, and we want to create healthy habits. We want to replace unhealthy habits with healthy habits so that we can really be optimized. And so we are going to learn how to align our daily routines with the rhythms of nature so that you are going with the flow instead of swimming upstream. And then you can have better energy, optimal function. You know, there's a whole science to the circadian biorhythms that show that certain things are best done at certain times. There are body processes that turn on and off, enzymes that function at different times. So we want to learn about those so that we can align with that and really harness that power. Then the second week is about eating, and this is probably one of my favorite topics, is food and really how to use food as medicine. And there's an old saying in Ayurveda, as well as I believe it was Hippocrates too, who said, you know, that all disease begins in the gut. So we really want to focus on optimizing digestive health and establishing healthy eating practices to reduce inflammation, to improve energy, to really ensure that you are getting all the nutrients that you need, as well as being able to absorb and metabolize those. So it is some, you know, foundational practices of eating. Of course, there's many ways to tailor it. We're going to discuss some of those, and you know, I could take a deep dive on food for days and days, but we're going to give you some healthy foundations so that you are going to start to feel better. And then stress management and sleep. So who does not deal with stress these days? You know, and stress, not all stress is bad, but when it is chronic and unrelenting, that is really when we have manifestations and impacts of that. So we want to learn effective tools to be able to manage our stress, to be able to get off that ledge, and be able to modulate our levels of stress and how we respond to stress. There's some amazing fun tools, easy techniques, as well as cool gadgets and things that can be helpful. And also sleep. Sleep is so important. This is when we restore our body. This is when a lot of those rejuvenative things happen to us, and detoxification happens as well. So we want to learn how to restore our sleep if it's been disrupted, so that we can get that optimal rest and recovery. And then we go into exercise and environment. That's our second E there. So like I said, there's no one exercise that is right for everybody. So we want to learn how to choose the right physical activity routine for you. And in terms of the environment, we want to look at those environmental exposures that can really make a big impact in your health. And I took a deep dive in this. You know, I have a master's degree in environmental health, and I kept going because unfortunately today we are dealing with such a toxic environment, all of these environmental stresses. It's just everywhere, and it's in our everyday lives, it's in our everyday products. So learning where that might impact your health and what to do about it. So we'll go into some of the top sources of environmental toxicity that you might be encountering. You might be surprised. I wrote an entire book on this called Resilient Health: How to Thrive in Our Toxic World, because I saw just how much we are being exposed, and I wanted to help everyone to identify that and reduce our exposure and eliminate toxicity. So that's the last part, is take out our trash and our toxins. So many of us, especially people who have chronic illnesses, and particularly what I'm finding is people with autoimmune illnesses, have a harder time handling normal detoxification. And, you know, as a trained Western physician, I was trained that we don't need all this detox stuff. We have a working liver, a working kidneys, you know, we should be able to handle this all on our own. But based on my research and my years of experience, I have found that that is not the case. And as you see with Kristen's story, for her, detox made a huge difference. So she was getting plasmapheresis, which is like the ultimate detox, where they were taking her blood out and cleaning it and then putting it back in. But we can learn less aggressive ways to help our bodies detoxify and improve our body's ability to handle these everyday toxic exposures. So in the environment piece, I go over how to reduce our exposures, but unfortunately, we can't eliminate every exposure. These toxins are just everywhere. So how can we deal with it? What are the practices and tools that can help us be able to eliminate these toxicities so that they don't build up in our body and cause problems? So the last 2 weeks, we put it all together. So I give you a lot. I know that I give you a lot of information in the whole reset program. So the last 2 weeks, we're working on integrating these tools into your everyday life. How do you make this into a manageable way of living so that you can live your life and not have to focus on it so much, so that it just flows easily? So that's what we do in week 7. And then week 8 is about staying resilient. And we discuss tips to maintain healthy immunity and stay well and prevent any further illness. So I am so excited to be sharing this with you. I've been working on this material for years and sharing it with my clients for years, and I want everybody to be able to have access to this information so that we can all feel better, be healthier, prevent and reverse illness. So this is an 8-week program, like I said. There will be video modules that you can do at your own pace, but preferably staying along with each week, because each week we will also have live Q&A sessions with myself, and I'm excited to announce that Kristen is also going to be joining us to support, because she has gone through this and I've gone through this. So I think there's nothing better than having a guide with you, who has gone through all of these things, who's troubleshooted, you know, how do you get through this? How do you eat this way? How do you live this lifestyle? So you'll have the ability to ask us questions so that you are able to really use these tools. And then we also have a private online group for community support where we can dialogue and share tips and share stories, share our challenges, and really support each other. So I hope that you have learned something from this presentation and that you are excited about the hope that you can prevent and reverse illness. You can reclaim your life. You can get back to living. You don't have to stay in that stage 5 and 6 disease modality where you're just on this cycle of never-ending medications. So even if you're able to shift just a little bit, if you're able to get a little bit more energy, have less brain fog, feel less pain, sleep a little better, digest better, you know, how much better will your life feel from that? Thank you so much for joining us on this webinar. I hope that it's been informative for you and that you will join us on the Resilient Health Reset Masterclass. It's launching soon, so please look at www.resilienthealthcenter.com/courses, and you can see more details there. I look forward to helping you through this journey, guiding you through this journey, and I hope that you join us. Check us out online, and I look forward to seeing you. Blessings to you. Bye-bye.